we've heard different estimates in terms of when U.S. cases might peak. Based on your understanding, when do you think it might peak, and where would it peak first? Would it peak in Seattle, where we've seen the first cases, or would it peak in a bigger city where the rate of transmission could be faster?
I suspect we will see the peak first in Seattle, in that region where the first outbreak would be, just based on the epidemiology of it. But I think that we're going to have many mini epidemics in different cities if this follows a pattern that we've seen with other infectious diseases. And I don't know exactly when to say the peak will be, because we don't know exactly where we are on the epidemic curve, because we've kind of not had a good idea of what communities have this virus, which communities didn't have this virus because of the problems we've had with testing. So it's hard to say, but I do know that we could expect to see cases go up for several more weeks. Yeah. Maybe we get some kind of a break with when the seasons change. However, that's not something to bet on. Yeah. But it's very hard to see exactly where this peak is going to be. That's adding to a lot of the uncertainty, because we don't know when this will be over, and we don't know how replicable what happened in China or South Korea is here in the United States.
All right, so doctor, making sure that our hospitals and our health system in general is prepared for this. I mean, we have seen some talk of trying to sort of create extra hospital space for people who don't have the coronavirus, just people who need other medical care. There was talk of moving one of the Navy hospital ships over to a port here in New York. I'm wondering, what are you hearing out there from the various health facilities about what they need to make sure that they can still sort of, I guess, conduct business as usual if we do start to see a spike in coronavirus cases?
What the thing most hospitals are looking for is alternative bed spaces. So there are hospitals I know that are looking at shuttered hospitals in their area to see if those could be reopened, trying to figure out alternatives to put patients that have recovered that maybe can't go home because they're not able to self-isolate there. We're trying to figure out how you will deal with taking care of patients if your whole hospital is full and you might have to use, for example, a field hospital, how you might set up triage tents in your emergency department, if that's outside your emergency department in the parking lot, if that's something that you may need to do. So there's a whole host of different needs that people have. And what we're trying, many hospitals want to continue their normal operations as best as they can, because there are other health needs that we have to worry about. People are still going to have heart attacks. People are still going to have strokes. They're going to have trauma. And we need to make sure that we can take care of those individuals as well. And I think this balancing act is going to be very hard. And we're seeing many hospitals canceling elective surgeries, canceling office visits. And I think we're going to see some ripple effects from that as well. So it's not easy what's going on here and how you're making these decisions about focusing a hospital's resources on dealing with coronavirus patients, forgetting that there's also all of these other time-sensitive medical conditions that we need to have to preserve the capacity to treat.